Many patients ask me, can I diagnose gynecomastia at home? Yes, surely you can diagnose the gynecomastia at your home. If you have enlarged male breast, you have to feel the consistency of your chest. If it is normal as fat, it is pseudogynecomastia. If you feel it rubbery under your nipple and enlarged, something is there, lump like thing, that's where it is gynecomastia. Then you might ask when to meet a doctor. You need to meet a doctor when it's causing social distress, it is quite enlarged and is increasing in size, it is painful and is bothering you. That's where you need to meet a doctor. You don't need to meet your friend or neighbor who might give you something, or your gym instructor, he might give you something which might cause issues. They might suggest you medicines. I would per se, medicines if have to be taken under the supervision of a trained medical personnel, either endocrinologist or a plastic surgeon. Patients come to me and ask me, does diet and exercise help you to treat gynecomastia? I would say most of the patients are unhappy with dieting and exercising. Diet will help you to lose the fat which is not resistant. By dieting they might go down. In chest normally the fat is resistant, so doesn't lose easily after diet. And with exercises what happens when you do push up or anything like that, your chest muscles pump up more, and when they pump up more, your gland and your fat is pumped up more ahead, so that makes it more visible, and that's where it causes more embarrassment. So what are the social stigma which normally a gynecomastia patient goes through? The social stigma is wearing a t-shirt is a problem, removing a t-shirt is a problem. When you wear anything, your nipple projects out and people tease you, and somehow the patient gets into a vicious cycle of thinking that is there something wrong, and that's where it affects his psyche, and that's where the patient gets bothered. I have met quite a lot of patients who are bothered by their looks, and it is not a psychological issue because there is enlarged male breast, and that's why you're getting worried. If there is no enlarged male breast and you're worried, then there's a psychological issue. Like exams might give you mental stress but not physical stress. Similarly, gynecomastia can give you mental stress, not physical stress. So physical pain is ideally not seen. It is just because the patients are worried by the looks of it. And with the growing social media, appearances have been very much important to a lot of people. That's why people get operated. So when to meet a doctor, I have already explained you. What will a doctor say? When you meet a doctor, the doctor will examine you. He'll feel the glandular part and he'll feel the fat part. He'll explain you why the surgery is required, if required, how you can counsel yourself, any blood tests are required, any hormone evaluation is required, and an ultrasound is required or not. Mostly I suggest my patients an ultrasound if I feel anything funny, but the most common cause is idiopathic. If I remove the gland completely and the fat, I'm sure they won't recur. A lot of patients come to me with painful gynecomastia. It's very rarely seen, but what happens is when the patient comes to me, I examine the breast, their nipples are more sensitive because they might fidget with it, and sometimes they are swollen because of the continuous rubbing of your t-shirt and everything. That's why people have painful gynecomastia. I would stress on the psychological evaluation also. So when I talk to a patient, I ask him, do you have any worrisome thing with this? Is it affecting your studies? Is it affecting your daily routine life? Is it affecting your daily cloth wear? Are you suffering from any anxiety because of this? Are you avoiding any social presences or gatherings? Are you at unease? Unease is a very common thing which people go through, and that's why people get operated for this. I would say it is very tough to cope up with this, as people are very much worried and people around you don't make you feel comfortable. It's a difficult thing to talk about to your parents also, to your friends also. If you talk to your friends, they might tease you, they might make fun of you, and that's why you feel uneasy about it. That's why you don't want to talk to your friends. And talking to your parents, most of the Indian parents don't understand what you're going through. That's why you are not able to convey the same thing to your parents. That's why I would suggest whenever you come to a doctor, you have to bring along your parents. The doctor is the best person who can explain your parents about what you're going through, and he'll be able to explain what is needed. People come to me about the stages of gynecomastia. I would say there are not stages. When you say stage, it's 1, 2, 3, 4 going ahead. There's no stage of gynecomastia, there are grades of gynecomastia. Most common classification is grade Simon's classification, in which we talk about the grades of gynecomastia. So there is 1, 2A, 2B and 3. 1 is just puffy nipple. There's mild enlargement under your nipples, nipple areolar complex. Grade 2A is moderate enlargement. There is no excess skin. There is moderate enlargement of gland and the fatty tissue. Grade 2B, it is moderate enlargement with excess skin. And grade 3 is female-like breast. So for patients, we have made it very simple. We make it 1, that is 1 Simon's 1. 2A becomes 2, 2B becomes 3 and 3 becomes 4. So what, it's very simple. If I explain them 2A, 2B, they get confused. That's why I tell them 1, 2, 3, 4. 4th is the worst grade and 1 is manageable. Now the patients, after the detailed consultation, understanding the grade and everything, they ask, can I self-treat it? It's very difficult to self-treat it unless and until you're very much motivated, dedicated and you understand that it is a normal condition. Then you can surely treat it yourself. You stop thinking about it, you work on your body, and then you see after 3 months if it is helping you, then yes, you have surely self-treated yourself, and it is not helping you, then you can go ahead with the surgery. So patients come and ask me, what is the ideal age for operating gynecomastia? I say 18 years and above. Ideal age is 18 and above and it's persistent, then we can operate. But sometimes it is, I have to operate below the age of 18 because the male, the student who is studying, is continuously absorbed by it. He cannot study. He is very much getting into depression. That's where you operate a gynecomastia below the 18 years. But you have to be very, very vigilant and you have to understand the mentality of the patient.